Yeah. So I kind of like went through on your website. So you're the owner and like director.
I'm fine with that. That's my title. I do like the holistic nutrition. Had a clinical practice like since 2005. But as I moved into thermography, right, like that just kind of consumed my time. And so I did give a little bit up in terms of like just my day to day seeing patients and just focused on like thermography.
Okay, well, why don't you explain to me what is thermography?
Yeah, so I think that's the age old question. So many people always ask, like, what is thermography, right? And I mean, you can get into the whole technical explanation. We use an infrared camera. That camera captures, temperature changes and creates a thermal map of a person's body. I sometimes prefer to say, like, why thermography? Like, why are we doing this? And why are we using this technology? But in all reality, like the role of thermography is the capturing of the data of a person, the temperature changes. A thermal map essentially is generated of the person's body. And, the thermal maps tell us whether or not areas of the body are too hot or if they're too cold. And all of those changes indicate something. So people that present with various patterns or skin temperature changes that are too hot, it indicates inflammatory changes. And people who sometimes present with thermal patterns who are much colder than we expect, those people typically struggle with things like congestion, poor circulation. They've maybe had a chronic condition for a long period of time. And everybody has their own unique thermal map. And essentially, like based on what story their body is telling, it tells us what's going on and what's underlying in terms of that person's health. So, as a practitioner, and having these tools like that, I've always used, right? Like the biofeedback, the thermography. I have some other devices that I've always used, and it's all like just to get a picture, right, or an understanding of what the problem is going on, like with my patient. Is it emotional? Is it dietary? Is it lifestyle? Is it like they've had a trauma, an accident, whatever? So I often think, I don't know how these practitioners are able to help their patients. If you don't know what's going on, how do you know how to help them? So a lot of patients do come to us because they hear from a friend or from somebody else that has come, and it opens their eyes to look at their health in a different way. For example, somebody may come in and they may be complaining of chronic musculoskeletal pain, right? And they've been seeing a chiropractor, but they're not getting any better. So by using thermography, you can see, like, is the problem actually musculoskeletal or is it something else? Some people can be complaining of like organ system symptoms, like maybe they're having heart palpitations or chest pain or something of that nature. Reminds me of a case that I had of a dental hygienist who always was having shortness of breath, heart palpitations, and she was like chasing those kinds of tests. She came for thermography, and I'm like, I don't think you have like a heart condition, like you're having symptoms, but her back from being a hygienist and the posture that she was always sitting in, it was very obvious that this musculoskeletal problem that she was having was likely contributing to those symptoms. So she worked on that. And, like 9 months later, those symptoms that she was having had gone away.
Is it a good one to monitor or watch for cancer? Like, I actually don't know this answer.
The
So,
age old question.
yes, I figured, you know what? So many people are going to ask me that. They're going to be like, what about cancer? Can it detect cancer? So I'm like, I better
Oh
ask
my
the
God. Oh my God. Why is this nuts?
question.
Yeah. So you know what? That's a really good question. And I think it's one that, I probably answer, I don't know, a million times a week, I feel, right? So the old sort of theory or thinking in terms of thermography was that it was going to be this miraculous diagnostic tool, right? Early detection. I'm sure a lot of people have seen like thermography marketed as that, right? It's going to see cancer early. It's going to let you know if you have a tumor early. So again, in all the years that I have done thermography, I've not seen that to be the case. It does not mean that in some cases we're going to see some abnormal finding in a woman's breast and refer them for further testing, and there's going to be something there. But to use it as a standalone like diagnostic tool for anything, it is not that kind of a test. It just doesn't. It doesn't diagnose, tumors. It doesn't see like specific like conditions like heart disease. It just is not a diagnostic tool. So then they're like, okay, well then like why would I have a breast thermography done, right? So well, one of the answers is to take a look at your level of inflammation, right? In terms of what's going on with your breast, because if you have inflammation in your breast, it's not like localized to that area because your breasts are attached to your body. So that would tell me that your inflammation is more likely systemic, right? And then I say, so let's look again at the whole body and see, what the source of this inflammation is. In some cases, if we're going to talk a little bit about breast applications and breast cancer, sometimes women come because they are diagnosed with breast cancer. And so I think in their mind, somehow they're either expecting to see like a confirmation of that. And sometimes we see a completely normal breast study, even though this person is diagnosed with cancer. But then if you again start looking at the whole person, sometimes you'll see something like, oh, you have this like extremely focal, like hot area, related to some kind of dental infection. So there is where the question starts, have you had a dental infection or a root canal or something on that side? That's problematic. And that may be the source of your cancer. And so again, it goes back to if you want to fix the problem, you've cut the tumor out, right? You cut the symptom out, but you don't then eliminate the source of the chances that problem is going to reoccur because you haven't dealt with the underlying problem. So it just, again, it depends on each person. And I say, like, it's not like we're going to put thermography in this little box. It's going to be a diagnostic tool for these conditions. It really is, but the person in front of the camera, and let's see what their story is and how are we going to help them, to interpret that story, and how are we going to help them, just resolve like their health issues and what's going on. So
when I went for my session,
mm-hmm.
I think it took about 45 minutes.
Yeah.
And why don't we go through what someone would expect if they were to see a thermographer?
Yeah. So, I mean, the appointment process is pretty straightforward, right? Once people book their appointment and pick a location and decide on what type of scan they want to have, they're required to fill out some, consent forms, intake forms, questionnaires, all that good stuff. They show up to their appointment. We do offer what's called privacy screening. So because you are naked when we image you, because we're measuring skin temperature, not clothing temperature, you are required to be disrobed for the scan. So in order to make it obviously a comfortable experience, we do have a privacy screening set up. So you're behind the screen, or technician, thermographer is somewhere on the other side so that you guys are not obviously, you're not sitting naked in front of our technician. The whole imaging process is done from like the function of the computer. So the camera is on like what we call an automated stand. I'm sure you saw it going up and down. Mm-hmm. And we have that system so that we can offer that whole privacy screening experience. So just as you're doing your scan, the thermographer just asks you to, move your body in different positions so that she can collect the images. Once all those images are taken, a report typically comes to you within about a week, and then we have a follow-up phone call to review the findings of your report. So it's hopefully in most cases it's a pretty seamless experience, and we try to make it as comfortable, for the patient as possible, because some people just don't like being naked. But usually by the end of that whole imaging session, people are, who cares?
Oh yeah, and really, right? It's like being in a room by yourself because of that screen. You can't see the technician; they can't see you. So yeah, I felt totally comfortable.
Yeah, and people love like that experience, right? Like the fact that it's private, and yeah.
Mm-hmm. Yeah, no, it was great. And then the phone call. Oh my goodness, that was because we get a report, right? Like I got this report with all my scans and everything.
Your images.
And then I had a nice call with you where we went over everything and I could ask you whatever questions I wanted.
Yeah.
Yeah, it was so
And
good.
right, is to get you to understand, yeah, like the context of your report. Because I think it's one thing to tell somebody like, oh, your report says like you have liver stress or there's some signs of lymph congestion or whatever. But I think, talking with the patient about like why that may be, I think is a whole different conversation, right? Because people can have liver stress for a variety of reasons, right? So what's your reason, So is it your lifestyle? Is it your level of stress? Are you exposed to toxins on a regular and routine basis? So I think, some people are like, okay, well, I have liver stress. Like, what does that mean? Well, let's talk about what that means and let's see what the solution is to, that liver stress of yours. Is it emotional? Is it, yeah, dietary, environment? What's contributing? And then, yeah, what's your path forward? So, yeah, understanding your thermography report and how it, like what it means for you, I think is, extremely important. And that's why we provide those follow-up calls, right? So that the report has meaning to the client.
Right. Yeah, because in mine it says adrenal stress. But it was so great to talk to you about
why that would be.
why that would be and what does that mean,
Yeah.
And like you said, it could mean anything to anyone because everyone's an individual. So
Mm-hmm.
I'm not an overly stressed person. So, and I'm not a go, go, go. I don't overdo it.
Yeah.
But I was toxic. So,
Mm-hmm.
right. I mean, a lot of times I think people think adrenal stress and they think that they're like actually stressed out all the time.
Yeah.
Clearly,
Yeah.
it's just my sympathetic nervous system was overstressed,
Yeah.
having a
And
constant battle going on.
exactly. And I mean, like having, like in your case, the breast implants, right? Like that can set the endocrine system into the state of fight or flight. So you may not be a stressed person, like you say. You're pretty chill, you're pretty relaxed, but there's something else that's like what we call an endocrine disruptor, right? And so, yeah, like that's the source there of what puts somebody's body into that like adrenal stress. And for some other people, it may be that they are high stress. And so, yeah, adrenal stress, like, okay, what does that mean for, you as a person?
You said that a lot of times people end up finding you independently. So is it that they
Mm-hmm.
go to thermography.medicalclinic.com and then look at what clinics you're at?
Yeah.
Like, can I come to say Divine and have thermography there, or is it where when you do the clinics in clinics?
Exactly.
Right.
So we do like our home clinic is in Brantford, like that's our main location. So yeah, people can come there. We operate it like pretty much just like we do every other clinic, right? So we provide imaging appointments availability in Brantford like once or twice a month, just depending on demand. So yeah, I mean, people can pick anywhere. They can come and have a thermography scan wherever it works for them, wherever it suits them. They don't have to be like a patient of the clinic that we're at. So yeah, they can just
It's good to know.
wherever we are, they can come.
Okay,
And
so when they go on the website and they look at the calendar and they see that you are at a clinic in, say, Toronto, they don't have to be patients there. I contacted your company to book in the appointment.
yeah,
You're not even dealing with the other clinic. Okay.
No, all of the bookings are just done directly through our, like we have an online booking calendar. So you can it's self-serve, just pick your date, select your appointment time. Everything is done like through us, through our company, through our webpage, just for contacting us. So we're all over. We try to make the service accessible.
Yeah.
And I think also like reasonable in terms of a price point. So
Oh, I agree. I mean, it was it was priceless. Yeah. No, I love the individualism of it. I just absolutely love that. And I can't wait for my follow-up. Well, I so appreciate you taking an hour to come and like just have a conversation with me about this, because this was life-changing for me. And so I just want to I want everyone else to know about it so that so that people can go out and find it. So well, enjoy the rest of your day, and let's just keep in touch.
Yeah, for sure.
All right. Well, thank
Thanks.
you again.
Bye.
Bye.
You're welcome. Bye.